Very good evening, my beloved colleague today. Before going to today's session, I have some to introduce to you as this is not like our AKT typical preparation course, not like AKT OSCE preparation course, not like a basic GP, but our target to improve all of the aspects of you. Similarly, when we're going for learning by the role play today, don't think that it is only for the OSCE candidate. Definitely, the OSCE candidate will feel very much thrilled, no doubt. But actually, the role play we have selected the comparatively the best method of learning throughout the world now ongoing because as a clinician, as a physician, we are dealing a patient. So you cannot talk to a patient directly without the preparation by yourself. Your talk may be embarrassing to the patient. Even your examination, physical examination, may be hazardous for the patient also. For this reason, our thought is like a warm up game or like a rehearsal, we will be here to do to deal a common problem by the AKT candidate, by the OSCE candidate, as well as our senior and junior GP. So main target actually to build you as a confident GP. This is our motto. Our topic, as you seen that dizziness. But in the exam, especially for the OSCE, I'm not telling in the MRCGP, South Asian pattern, anywhere. What you are thinking that you think the patient is waiting outside. You don't know about the patient. Minimum or maximum, rather it's a maximum, you know that Mr. Abdul Majid is waiting outside and his age is 65 because he paid money for you. Most of the time, this is the system. And you got the slip or you have seen in your computerized electronic records. The next patient is Mr. Abdul Majid and age 65. Somewhere some arrangements are there in the outside, those who are very busy GP, that your assistant is measuring the blood pressure, pulse, SpO2, sometime weight and height, including the BMI. Up to this, not more than that. For this reason, in the South Asian exam, almost similar throughout the world also, this type of instruction given, patient name, age, and some vital signs are relevant. You know that pulse and blood pressure, two parameters, two findings are mandatory throughout the world by each and every doctor, not the GP. Unfortunately, some doctors are not measuring. This is very unfortunate things are happening. But respiratory rate is a part of the vital sign. Sometimes not needed because you are looking the patient. Patient is not the breathlessness. So respiratory rate, sometimes peripheral oxygen saturations are not mandatory to be checked. But any little suspicion is there, you need to check. And your attendant or assistant also checking outside your chamber. He or she is preparing the patient for you. For this reason, we have given you in the screen, possibly you are looking, the minimum informations, which is the information actually you know earlier before entering your chamber. That means your patient is entering your chamber. But what we have to do in the chamber, you will try to do it with us. Dr. Iram, you can don't think that you are preparing the exam. It will be of 10-minute session or like this, okay? You can start now, Dr. Iram. Like OSCE,
Okay,
not as it is, but
okay,
similar OSCE like. You start with, please.
okay. Hello, Mr. Majid. I am Dr.
Hello.
Aram. How can I help?
Doctor,
Hello, Mr.
actually, thank you, doctor. Thank you. Good evening, doctor. Actually, I was waiting a little long time outside. Anyway, I got the chance now. I'm very happy to see you. Actually, I was having the problem of my dizziness, doctor, last few weeks. It is very disturbing for me. I like to get a very good treatment from you now, doctor. Please help me, doctor.
Okay. First of all, sorry to be wait for me because I am busy in patients. And Mr. Majid, tell me about that. What do you mean by dizziness?
What do you mean means, doctor? I'm just feeling not good. I'm afraid of fall, doctor, sometime. And what do you mean actually? Can you make it clear, doctor? What do you like to know further
Yes,
about dizziness?
yes. I would like to ask, do you feel any thing spinning around you?
Oh, yeah, doctor, exactly. You are right, very right, doctor. I'm feeling there's something spinning, doctor. Yeah, doctor.
Is the thing is spinning around you or you are spinning?
Actually, I cannot say. Sometime my head is spinning. Sometime my surrounding also is spinning.
Okay. At what time you are feeling this thing when get up from the bed or lie down?
Actually, sometime lie down, doctor. But get up time, I don't understand. When I lie down, sometime, doctor, when I turn the right and left, especially my head, at that time, doctor, I feel more.
Okay. And what do you feel at that time? You feel nauseous?
No, no, doctor, no.
Okay. Do you feel any headache?
No, doctor.
Okay. Do you feel any blurring of vision
At that time or any time, doctor?
at that time?
Oh, no, no, doctor, no.
Okay. And do you feel any ear pain?
Ear pain? No, doctor.
No. And what about your vision? It is
My
weak
vision
or
is okay. No, no, doctor. My vision is okay. And I checked my eyes also a few months before. Everything was fine.
okay. And Mr. Majid, uh, anything else you have with the dizziness? You feel any other
Any other
problem?
problem? No, no, doctor.
Yes.
Sometimes I have joint pain, doctor, occasionally at the knees, and I take the paracetamol for this. It's become okay, doctor.
Okay. As you said that Mr. Majid, you are has worried you have fall because of dizziness.
Actually, I didn't fall. I'm afraid. Yeah, doctor. I'm afraid when it
Why
happens,
you
doctor.
are afraid?
Because if I fall, doctor, I might have injury, doctor.
Okay, okay. Mr. Majid, do you have any long-standing illness just like blood pressure,
High blood pressure? No, doctor.
sugar?
Sugar problem. 6 months before it is checked, doctor. My sugar was okay at that time.
Okay. It is, Mr. Majid, it is your first time or you have feel even before that dizzy?
Many years before might be, doctor, but it was very short lasting. It was not disturbing much for me, doctor. But now recently, what is happening last few weeks, doctor? It is very different. It is very different. It's almost newly happening to me, doctor.
Okay, at that time you are taking any medications or consult to the GP?
At that time means, doctor?
When said that you have a long time before you
Before,
feel
no,
dizzy.
it didn't need any medicine, doctor. One day maybe I came home from outside, and possibly at that time I didn't get enough sleep, and the following day I had the problem. But after taking the sleep, everything was fine. So far I remember, it was not disturbing me also, doctor, at all at that time.
Okay. Do you have any allergies to the medications and any other things?
Medicine, it was not known before, doctor, with any medicine.
Okay. Do you have any family history of blood pressure, sugar
Family.
illness?
Oh, My father had diabetes. My mother also had diabetes, doctor. They died, doctor, just few years before.
I'm
Otherwise,
sorry to hear this.
they were okay. Okay,
Okay, I'm
doctor.
so
Okay.
sorry for hear that. Okay, Mr. Majid, I would like to ask few personal question. It's okay with you?
Okay, doctor. Okay.
Do you drink alcohol?
No, doctor.
Do you smoke?
No, doctor.
Okay, what do you do for living?
I am actually got retirement, doctor. Just 2 years before, I was journalist.
Okay. How's the thing at home?
Fine, doctor. Otherwise, I'm getting the pension. My wife is a school teacher. She is very fine. She has no problem, doctor. And I have two son, one daughter. They are studying now.
Okay. And does your dizziness impact your life?
Yeah, yeah, doctor. I told you I am afraid of falling an injury. And when I take my book, doctor, from the shelf, at that time, doctor, I feel dizzy. And I'm afraid, doctor, at that time.
Okay, okay. Do you have, what do you think what is running on? Do you have any idea?
No, doctor, I don't have any idea, doctor, but I'm thinking something wrong in my brain, doctor.
Okay. What do you think? Why do you think that wrong is your brain?
Because this is in my head, doctor, and the brain within the
Oh,
head. Am I wrong, doctor?
yes. No, no, you are right.
Okay, okay,
And
doctor.
do you
Okay.
have any specific concerns and worries?
No, that is the thing, doctor, that I am afraid of falling, doctor. And if it is in the brain problem, doctor, what will happen? Now I am at the age of 65, and how many years I will survive, doctor? And if my brain is in trouble, doctor, what will happen in future? I am afraid, doctor, for this.
Okay, okay. Do you have any scan of bones before that? Any
No, no, doctor, no, no,
history of fracture?
no, no.
No. Mr. Majid, I would like to examine you. It's okay with you?
Okay, doctor, okay, okay. Yeah,
I
Dr.
would like.
Iram, what do you like to examine? You just tell me the name of the sign one by one. Definitely, you
Okay,
will tell the relevant sign, and whenever needed, I will give you some findings of the sign. Okay?
okay, okay. Pulse is already given,
Sorry,
and
Doctor. As Dr. Iram, don't mind. As I told you, it is not like our OSCE exam
okay,
preparation. Dr. Tayyaba raised the
okay, okay.
hand, and I'm
Okay.
ready also, and I appreciate if Dr. Tayyaba wants to say something because before examining, we have to summarize our history or data by talk. It is very right. If Dr. Tayyaba wants to say something, you can open the mic, please. Dr. Iram, just keep in the line with us.
Yes.
Sir, I was just requesting if after Dr. Aram, I can also do the role play.
When today?
Yeah, for this case.
Doctor, no, it is a little different. We are inviting before also. You can take the chance later, no problem. But
Okay, okay.
any piecemeal area, if you want to add, we can give share to other, no problem. But the main bulk, as Dr. Iram is actually started, I think she is to finish. Okay, better.
No, no, after that, after her.
Let's
After
see,
her,
let's
if I
see,
can
let's
also.
see, let's see.
Okay,
But Dr.
okay.
Tayyaba and
Fine.
anyone, can anybody join here to discuss about the history part? It is a very important part of the
Yes, sir.
consultation.
Yes, sir. I want to
Please,
add some points.
please.
Okay, sir. I can't recall that did she ask or not, but trigger is it for how? I don't remember if she asked about for how many days you are having this.
Yeah,
Uh,
it is 2 or 3 weeks already talked by the surrogate today.
okay,
Then,
and
sorry.
each day this is happening every day or it is intermittent.
Yes, I think Dr.
So we
Iram
should ask,
didn't
is the
ask. Yeah, Dr. Iram can reply. Possibly Dr. Iram didn't ask it is intermittent or continuous.
Yes.
Is it?
No, no, no. I didn't ask intermittent and
Yeah, continuous.
continuous.
Okay, Dr. Tayyaba, now tell me why this is important.
Sir, it helps us in differentiating between the central and the peripheral causes of vertigo.
Okay,
Um,
then
and uh, and
if it is, I am
uh,
giving you the clue, don't worry. If it is intermittent, how it
yes,
differentiate
sir.
further by the duration, by seconds, by minute, by day? How?
Yes, sir. For if it is for a few seconds, it could be due to BP, benign positional vertigo,
Right?
and if it is treated by, we can ask further if he had any, if you had patient had any history of viral illness preceding the uh, vertigo, then we can
Yes.
think of vestibular neuronitis or
Meniere's disease.
uh,
Meniere's
yes,
disease.
sir. Meniere's disease. Yes, sir.
Very
And
right,
if
very
we
right.
can ask about, is it related to the position, what triggers the beta, what triggers the headache? So any change in the position of the head or any change in the position of the body, like from sitting to standing, so it can also give us the clue
Thank you. Thank you,
about.
Dr. Taib. Up to this, can I pause you and take care of your surrounding? There might be some interruption of the sound. Dr.
Sorry.
Iram, my response as
Yes, sir.
I have listened to her, and all of you listen to Dr. Iram also. Anybody can correct us. Dr. Iram asked, Dr. Iram possibly didn't ask directly, did you have any viral illness and others? But Dr. Iram asked, did you have any illness before? Are you okay before? Do you have any other symptom like hearing problem or any other symptom? So far I can remember. Am I right, Dr. Iram?
Yes, sir.
So even doctor didn't ask viral illness before, or patient tell, okay, I did have viral illness and other, but now I didn't have any other symptom, then it may not be Meniere's disease. If Meniere's disease is there, they are the problem of the hearing. There are pain or heaviness feeling in the ear. So to reach to a diagnosis, you may not get some clue, but you may get some other clues. It will be useful to reach a diagnosis. Don't worry that, sorry, some noise, maybe Dr. Iram, I don't know with you. Take care, take care. So just listen to me up to this now. You sometime you didn't directly ask, did you have diabetes, for example. Patient cannot tell that I don't know. But patient said that my sugar is tested before and it was found normal. So indirectly you got the answer. Patient cannot tell the name of the disease. Sometimes patient can tell the symptom of the disease. So you will be much efficient to pick up the symptom. Why patient did have this symptom or patient already having the additional symptom right now. For this reason, those who attended our session before, we advised all of you to ask the question when you heard a symptom, immediately ask, do you have any other problem? I think Dr. Tayyab also can remember. That is the glamour. Not asking, can you tell me more about this? I always emphasize this. Patient can tell you definitely some other symptoms, more likely. But sometimes patient have only one symptom and diagnosis will be very peculiar and unique. For example, today now, what Dr. Iram got is summary is that is 65-year male gentleman, right? 65-year male patient having only problem of the vertigo. And it is very nice. Dr. Iram clarified earlier meaning of dizziness. This is very challenging. This is very challenging. It is the first job of you, especially in the dizziness. It is a vertiginous, that is a vertigo or non-vertigo group. So in the vertigo, now classify further. It is a peripheral or central. If it is a peripheral, then ask about the duration of each episode. If it is intermittent. Okay, Dr. Iram, if you are free now, you can open mic. So if
Yes, sir.
Dr. Iram asked what is the timing of the episode, I think almost you will tell what could be the diagnosis even before examining. Dr. Iram, do you like to ask me that duration, please? Repeat now.
Okay. Mr. Majid, ho- how long you have this?
How long means, doctor? It is last around 3 weeks, doctor. I am suffering. I told you.
And uh, either it is continuous or it is come and go.
Yeah, it is coming and going, doctor. Not all the time.
And at what time you feel that?
I told you, doctor, when I move my head from the left side to the right side on the bed, and sometime I try to take my book from the shelf at that time, doctor.
And how much time they remain?
Oh, it is near about 20-30 seconds, doctor, each episode.
Okay.
Up to this enough. Up to this
Yes.
enough. I think you understood. Who a little advanced colleague today. I think all of you understood. I am not asking Dr. Iram, I am asking others. Who will say now, only by the history, to tell a diagnosis?
Benign, benign
Benign,
paroxysmal vertigo.
benign positional paroxysmal vertigo. Who will disagree today? Anyone to disagree with the diagnosis? I think everybody thinking that how can I disagree? Maybe. So I agree also from my side about the diagnosis. That is the thing I told you when Dr. Tayyaba raised the hand. After the history, you should have, and very confidently, you will have a summary. Sometime history is enough to say a diagnosis. So more likely up to this enough to say the diagnosis. But as a physician, as a family physician, as a GP, to reach a diagnosis, it is not enough. For this reason, Dr. Iram asked about the smoking, alcohol, with whom you are living, right? How many children also came out? What is your job? Okay. You will come to the examination. Don't worry, I will go there. Everybody is waiting. What will be the examination plan? Dr. Iram, I am asking you, why are you asking about the job?
Uh, because sometime didn't concentrate from the job, or it will cause some
That
jobs,
you mean that the job will be difficult to be
just like
performed?
any mill and anything else job related for overtime.
A job related. You means again trying to relate the diagnosis, job related diagnosis, cause of the
Yes.
symptom. Okay, could be vertiginous. The job is vertiginous, but could there be any other aspect of asking the job? Dr. Tayaba, please. You raise the hand.
Mhm.
Yes, sir, because if he's having dizziness, we have to know what sort of job he is doing. Maybe he put his life is in danger if he is if he is a driver, or if he
Okay,
is
okay, Dr. Tayaba, please. Sorry, I pause you because this is the basic understanding for all of you. Don't be hurried. Dr. Tayaba, keep your hand raised. Asking the job may be relevant with the diagnosis, may be relevant with the consequence in future. Everywhere, doctor. This is very basic idea. So Dr. Iram tried to correlate the etiology. But now Dr. Taiba is saying aftermath, consequence of the dizziness. For example, if patient is driving, okay, so it may be difficult, right? He may do accident during driving at the time of the dizziness because this is a vertigo. Dr. Taiba, may I ask you, will there be any other job may be dangerous for him as a consequence?
uh, yes, sir. If he is a laborer, or he is climbing buildings, or he's a
Yes,
construction worker.
yes, fine. Another job, construction work, or even the industry where he has to deal with the any what I
Heavy
say,
Machine.
machinery.
machinery. You mean? Yes, he may fall into danger in the machine, right? In the factories. So
Yes.
job is not only relevant for diagnosis, doctor. This is a mistake in my experience, doctor. In my college, in direct students, and everywhere I was discussing everything. This is a holistic approach. If you want to think more and more information, you will get there. Don't think very, very narrowly that I'm asking this thing only for diagnosis, but it can give more than your diagnosis. For this reason, each and every question will be very important for you. Don't ask any question without any relevance because you will get many questions with relevance. Somebody telling before also in our basic practice session in the exam, I am asking routinely. I am examining routinely. My suggestion, better not to think routinely because you will have many specific things to ask, many specific things to examine. Routinely keep it very in the second line or third line. If possible, you can ask routine questions. And what routine questions to be asked? Already we discussed many often. For example, smoking, alcohol, health, hazardous behavior as a part of the holistic approach, not for the diagnosis. In the female pregnancy state, mandatory. In the geriatric patient, for ID, right? In the baby, P bind. These are very some specific areas. Few routine questions according to the age. Otherwise, for the diagnostic purpose, not much important. HD, maybe Dr. Homadad, if I am not wrong. Open the mic, please.
Yes, sir. Assalamu alaikum.
So I'm sorry, HD, I tried, I need to
That's o-
remember all
that's
the time.
okay. That's
Please.
okay. So I just wanted to ask if you've already come to your diagnosis with the symptoms that he's presenting with, should you still check for any red flag signs like loss of consciousness or
Very
weakness
right,
left
very
side
right,
of the body?
very right, very right. You could have the red flag in the history also. You finish your examination because this is a stepwise progression of your consultation, not only exam, even in your chamber. When you summarize the diagnosis to the patient, then you can come back also. Ask the question of the red flag, no problem. You will be very happy. I will be very happy if I can come to a diagnosis first. Okay? No
Okay.
doubt. But it is true. When you ask the second question, like, do you have any other problem? Still, you didn't start your talk, right? Only you listen that patient having the dizziness. But you proceed with the dizziness a little later. Okay, and if possible I can give you one example of the role play script like a dialogue, not for each symptom, maybe one or two symptom we will share in the group. You will understand how to design the talk. Okay, so when you said, Mr. Majid, do you have any other problem? Patient suddenly could say, doctor, actually I feel weak in my right hand or right leg. Doctor, where is Dr. Amadad? Why you became off? So now you got the red flag now.
Yeah. Yes.
So that is I always emphasize the importance of the second question from the very beginning. And it is your job as a physician everywhere, identifying the red flag sometime very important. Okay, before diagnosis also, because we have to be very safe doctor. And before reaching the diagnosis, before reaching the diagnosis also, I can help the patient by identifying the red flag. If it is very dangerous, I will send to specific areas for the support. That's all, doctor. Okay. So red flag
Yeah. Thank you.
preferably to ask earlier in general practice. In our practice, I'm not telling about the OSCE. But for the OSCE, you could ask the red flag a little later because you need to be happy about your diagnosis in the exam. Okay, doctor?
Thank you, sir.
It is not very hard and fast. It is just I'm
Yeah.
telling a prioritized way how to do it in the exam and how to do in your practice. Okay, that's all. So I think up to this our history, as you are no other one also adding something. I think all of you happy up to getting this history from this gentleman. And now you already possibly noted down those who are very sincere today. If those are very busy, I don't like to ask you also. Now come to Dr. Iram, please. Dr. Iram, now
Yes, sir.
tell me your examination plan and talk to Mr. Majid what you like to do one by one. Later on, again, we will come to the discussion after the examination findings. Please, Dr. Iram, examination.
Pulse, pulse and BP already given,
Given,
but
given. Yes.
I would like to do the sitting and standing BP to see the postural drop
There is no postural
and
drop.
anemia,
Patient not anemic.
jaundice.
No jaundice.
Okay, I would like to walk for me, and
Patient,
I
yeah.
see the gate.
Patient can walk and the gait is normal in front of you now.
Okay, I would like to see the Romberg sign to close your eye and close your foot and
Rombergism is not there.
okay, and I would like to see the nystagmus to
No
examine
nystagmus.
the eye
No,
movement.
no nystagmus.
Okay, that's all.
That's all.
And I would like to auscultate the heart
Normal.
and see the heart rate and
Heart rate already
regular.
given, pulse rate, but okay, you will try to check the pulse deficit if you suspect atrial fibrillation. Is it?
Yes,
Anyway,
yes,
heart rate is same like 88.
that's all.
That's all. Okay. Now I think many colleague will tell something more that I like to check this thing more. Who will tell now? In the history, you got near about the diagnosis of BPPV. Please, anybody could add something? Dr. Mona, please.
Yes, sir. Halpic
Hello, guys.
maneuver.
Oh, Dr. Iram again like to take this floor. Okay, Dr. Mona, can you help Dr. Iram now? She is to finish. Again, Dr. Iram. Mona will be later.
Yes.
Dr. Iram,
Yes, sir.
what you like to do?
To sit on couch and lie down to see the
You just tell me the
uh,
name of the maneuver. I understood what you like to
Halpic
do.
maneuver.
Dix-Hallpike maneuver. Okay. So as a doctor, as a physician, you need to know how to do the Dix-Hallpike maneuver. It is your job. You can see the YouTube and other, no problem. This is not our time today to discuss. In the Dix-Hallpike maneuver, we very, very expect that it will be positive in this case, right?
Okay.
What do you think, doctor? Dr. Iram,
Yes.
you are
Yes, sir.
expecting that Dix-Hallpike maneuver will be positive. Okay, I will come to there. Suddenly, I'm just making a fun rather to say and making it practical. You didn't do it, Dr. Iram. Your patient left outside after examination. Though from the history, you are thinking that it is a benign positional vertigo. You may give some medicine, may not give some medicine. What will you do now? Patient is
But
still outside.
sir, on if I suspect the benign positional vertigo, I give medication and also how to resolve it to do the exercise for relieve the vertigo
Okay, but
and
you are
or
not sure. Doctor, clinically, you cannot tell confidently too much that it is benign positional vertigo until you do Dix-Hallpike test. Okay.
yes.
So I am
Okay.
telling that very differently. What I I am to do, I will call the patient back again. Oh my God, I didn't do the Dix-Hallpike test like today. You forgot to do it. You will call your patient again and feel sorry. Okay, can you lie down? I need to check more. Is not it, Dr. Iram?
Yes, sir.
That is the thing. Okay, I am just telling something out of the box. No problem. So you have done this Dix-Hallpike maneuver and you found this is positive. Will you go for further examination? This is very thoughtful, critical question for everybody. You become confident about the diagnosis of benign paroxysmal positional vertigo. That is okay. Will you do any other test of the patient today? And how we design further to examine further other than those what you have done? Already you have done anemia. Can anemia be related with the dizziness or vertigo?
Yes, sir.
Could
Sometime.
be, could be, could be. It is not vertigo. Patient can tell vertigo, rather it will be dizziness. Or sometime fatigability. Remember, it's a common presentation of anemia is fatigability, right? Fatigability in our medical language. Patient can tell fatigability as dizziness. That is, you have done nicely earlier. That what do you mean by dizziness? It is not, it is a spinning something or not spinning something. So fatigability can be. For this reason, anemia may be relevant here. But it one of the presentation of the posterior circulation stroke is vertigo. I think some of you, possibly minimum, some of you understood today. Will you like to examine now neurologically? Critical question, a quiz question to you today until you got the data. Patient didn't tell you that I am having the limb weakness. Dr. Iram already told the patient,
Hint,
can you
hint,
walk for me? Dr. Mona?
Hint examination for central and peripheral to differentiate between peripheral and central.
Okay. Whatever you examine,
Doctor.
hint means head, neck, you means, doctor? Head.
Yes, yes.
Can you elaborate it? Head and eye, head, eye,
Eye movement. Yes,
ear, nose, throat. You mean like this? Hint?
yes.
Okay. But thing is that if you are very confident about the symptom, okay, that patient didn't have any other symptom relevant with that organs. Now you got the one organ relevant is ear from the history, benign paroxysmal positional vertigo. It is a vestibular problem, right? Otolith movement is there. You already got it. But other diagnosis, you didn't get any symptom from other part of the diagnosis. That means like the differential diagnosis. There could be many differential diagnoses. So in the history, if you are very sincerely, you were very sincere to ask many questions regarding other organ related cause of the dizziness, and very confidently you understood that there is no symptom at all. Okay. Then you have done one maneuver, for example, in
Maybe
the
nail.
nervous system. Sorry, Dr. Mona, let me finish few seconds. In the nervous system, Dr. Iram said that, can you walk for me? Patient stood up and walked. There is no problem of the gait. Okay. So we may not examine the patient neurologically in this case, doctor. And even in not only in the exam, even in the real life also, no need. Because you're almost certain clinically this is BPPV because your maneuver also positive here. As patient didn't have any disease or symptom in the ear more than that, only the vertigo, no problem in the throat, no problem in the nose. So if you ignore the examination, no problem. Most of the time you will be right. Nothing will be 100% in the world. But if you didn't ask the symptom before doctor, possibly you forgot to ask. Then at the time of examination, you could ask, do you have any problem of the nose? Then can I check your nose? In this way, you could add some further examination of the diagnosis again. Dr. Mona, did you get the answer, please? Again, anybody wants to add something in this planning? This is a very important planning as a physician all the time. We have provided you the checklist just to go through that what may be relevant things you need to explore, right? If you have seen the dizziness checklist, all the reasons are accumulated there as an open type. There is no targeted diagnosis there. Our suggestion, advice to all of you that don't be targeted in your preparation. That I am now practicing the benign positional vertigo. I am now practicing the what is the vestibular neuronitis. I am now practicing the Meniere's disease, especially those who are appearing for the OSCE. I don't know, am I clear or not? Possibly you have done in this way. You just read this thing as investigation plan and the management plan. It will be your second line preparation. But first line will be as an open type practice like today. Dizziness, sometimes some clues are there. You don't know the diagnosis. Okay. But don't tell your colleague that, okay, let's do now about Meniere's disease today. Okay. Initially, it may be helpful, but when you become a middle part of your preparation, at the later part of the preparation, always practice the case as a blind one. Then you will synthesize at then. Anyway, now come to the case again, Dr. Iram. I think you are ready. So you examine the
Yes.
patient and you have done that Hall-Pike maneuver. It is positive. Now you are confidently thinking that it may be benign paroxysmal positional vertigo. Next part of your consultation, please proceed, doctor.
Okay, from your history and examination, most probably you have a benign positional vertigo. Do you know about that?
No, doctor, what is this? Is it any dangerous brain disease, doctor?
No, it is not a dangerous, but sometime um, uh, some sounds cross from ear to the brain.
Okay.
In between, there is an crystals appear and not probably go to the signal to the brain, and
Okay.
that's why brain feel the dizzy.
Oh, I see. So it's a problem in the ear, doctor, you mean, not in the brain?
Yes.
Oh, anyway, doctor, is it, you said something, what is a benign? So far I understood it is not dangerous. Am I right?
Yes, yes.
Oh, it's
It is
relaxing,
not.
doctor. It's very relaxing. Thank you, doctor. Please proceed, doctor. Anything, doctor, you like to tell me now?
Yes, I would like to say few journal mayors to go. It's first of all when you are lying and you sit up you to the bed before going to the walk.
You mean
Because if you are,
any exercise, doctor, you mean?
yes, I would give you some leaflet to do exercise
Fantastic,
for
doctor.
this,
Fantastic.
and I would like to go some medication which is known as chlorperazine
Oh, medicine
twice
also
daily.
fantastic. It will be very good for me, doctor. If you give me the any very good medicine, doctor. Thank you, doctor. Thank you. Okay, doctor.
If you feel, if you feel more dizzy and you have some headache and you cannot maintain your posture and you feel more dizzy, you come as early as possible to me.
Okay, okay, doctor.
Do you want to anything ask anything more?
Yeah, yeah, doctor. Doctor, you said me that you will give me a literature. I will read it. But any exercise, doctor? I have seen many exercises in the YouTube, doctor. May I get it there, doctor, to see directly as a video, doctor?
Yes, you can do that, but sometime a physiotherapist also guide you to do these exercise, how to
Oh,
do these exercise.
so do you like to send me to the physiotherapist also?
Yes, only one time they guide you how to do the exercise, and you also watch in YouTube and do daily exercise for this.
Oh, good, doctor. Good, no problem, doctor. If you don't mind, doctor, can you give me any YouTube link, doctor, to see?
Yes, I give you a link to YouTube.
Okay, it will be
Some
very
other
good,
link याद
doctor.
नहीं.
Okay, doctor. Okay, okay, fine. It will be, I think, useful rather because I have seen many YouTubes, doctor. Nowadays, many doctors are there in the YouTube. A lot, doctor. Isn't it?
Okay.
Okay, doctor. Fine.
I
Thank you, doctor. And other thing, doctor, that as you said me that you will give me the medicine. Will you not do any test, doctor?
uh, I would like to do some lab tests, complete blood counts
Okay.
to see how much your hemoglobin
Okay. Okay.
uh, and also do the some urea creatinine electrolytes, uh, which is known as either your sodium potassium electrolytes are normal or not. And
Oh,
I
sodium
would like
potassium
do
means some atom, doctor, or something?
some salts in
Oh,
your
salts.
body,
Okay.
and also do the vitamin B12. And
Okay.
sometime because of these deficiency call the deficiency is the cause of vertigo, and
Okay.
thyroid function test. It is
Oh.
your gland neck gland test.
Oh, you mean that, doctor, there might be some more problem with me, doctor, other than the ear problem?
Yes, yes.
Oh, is it very important, doctor, mandatory? Because I don't, as you said, doctor, I don't have enough money, doctor, to spend today.
If you are feel better from do the exercise and tablets,
Okay.
uh, you can not to do any other test. And if you to exclude the other cause, I would recommend you to the social services who provide test, who provider to help you for the test.
Oh, will they give me money, doctor, from the social service?
Help you because of some labs which is least
Anyway, doctor, I will
which
be
is
very grateful, doctor, if you can make an arrangement for me. No problem, doctor. Okay, doctor, thank you very much. I think you have said me a lot of things. If you have to say anything, doctor, you can tell me. Lastly, doctor, just I like to know how much, doctor, I will have this problem to get cured, doctor. How many days, doctor, or weeks it be needed?
every patient is response differently. Sometimes it is resolved in a week, and on sometime it is delayed to take a 15 days or a month.
Okay, okay. That means I can get assurance that it will not disturb me too much, doctor.
uh, yes, I think.
Thank you, doctor. Thank you very much, doctor, for your nice consultation for me. Hope to see you again, doctor, maybe after 2 weeks. As you said me, after 2, 3 weeks, it will be okay.
Yes, sir.
Thank you very much. Thank you very much, doctor. All the best. Fine, Dr. Iram. Dr. Iram, did you feel any stress to consult today with your patient?
Yes, sir.
Why?
Because I'm not prepared to for this case, and I do blindly.
No problem. You are all the time blind to your patient in the chamber, is not it?
Yes.
Why you become afraid for me? I am just trying to enrich your information, trying to improve your skill, nothing else. We are all a learner. I am also learning, doctor. Don't think me as a teacher today. Not today, every time. I'm just trying to be a mentor, not more than that. So don't worry. I'm requesting all of you. Feel free to share anything. So everybody try to do it. Not that only you are
Thank you, sir.
preparing for the exam or something. You have to do all the time because you're going to be physician. You are going to talk to your patient. Okay. What we are learning in our traditional learning in the institute, especially in the South Asians. Okay. Maybe Sri Lanka or Pakistan are advanced, but other South Asian countries are not much advanced. I know, even my native country also. That just reading the book, getting the knowledge, acquiring many things, but we are not implementing with the patient. Then I told you from the beginning, before talking to the patient, before examining the patient, we should make a rehearsal. And it is very lessly happening in our institute. And I am the witness because I am a teacher now in medical college here. For this reason, to overcome these throughout the world now, role play is the most efficient and important part of your learning that we adopted today. Anyway, our main agenda is not to tell you the dizziness, benign positional what I got to talk about. As you understood, a lot of time we have taken near about 40 minutes plus in the consultation, discussing many things and criticizing also. I am requesting all of you today, if we do some mistake anywhere, any confusion, you can raise it and discuss with us. Otherwise, I am proceeding further. This is the checklist in general we have generated for you. It is not that you have to follow one by one, number two, number three lines, one after another. It is just an impression for you, headline of the checklist. But another checklist, according to the information, the detail given to you as a PDF, it is only for the checklist for any case, any symptom to come across in the OSCE station mainly, but the symptom based checklist given to you, how to design for the practice purpose. I like to repeat, you may not appear the exam immediately, but you need to do the practice with your friend or colleagues at the home. If you want to make your performance in your chamber better, definitely there is no doubt it will be better. Dr. Tayeba to say anything? Open, please. Dr. Tayeba, please.
Yes, sir. I wanted to ask you, is it was it necessary to go for CBC in this case if you have we find no anemia or anything else to go for CBC?
Very nice question. Your instruction is to examine. You see, look at the instruction for the exam again. The consultation, clinical examination, and management plan. Is it, Dr. Tayeba? Management plan. Dr.
Yes,
Tayeba,
sir.
yes.
Yes,
So
sir.
in your checklist in the OSCE exam, I have shown you before, investigation is within the management plan. It means you have to do some investigation. But what will be the relevant here? What will be the very important today or can be done later? You can decide. For example, for the patient
Sir, it would.
management today, what Dr. Iram said, I agree with her. CBC, other thing not needed today because clinically you are much confident with the Dix Halpike test. It is a benign positional vertigo. But some cases are not like this. Somewhere you can do CBC. CBC is a very golden investigation. You can make it fit for every patient. But if you think that, okay, why CBC is not, why we should plan CBC, no need here. Other than you can send a blood sample for the sugar for the patient. Is not it, doctor?
Yes, sir.
Because age is 65,
Yes.
father, mother, diabetic. Patient sugar check 6 months before. Don't forget the patient in statement and the talk. 6 months before it is checked, there is a positive family history of the diabetes at the age of 65. It's not important to check blood sugar. So you can send that. You can send the patient blood as a sample advice to do the blood test to exclude diabetes. Or I prefer to do as a POCT, point of care test in your chamber. It is not diagnostic test, but initially you can have an idea what is the current blood sugar in the capillary blood by the capillary glucometer. Check it. So in this way, you can cover the requirement of the investigation. This is the technique of the exam. Clear, Dr. Taiba?
Yes, sir.
So always try to think your OSCE score chart. We talk it many often before. I think you know, as I remember you. Okay. Any other question, doctor, from anyone? Those who are not appearing OSCE, in the AKT point of view, how this dizziness will be important. I can remember already we started our AKT recall class. We already finished one session day before yesterday. Hopefully, maybe in the coming one day after tomorrow, also we will notify you. Finally, you just keep your eyes for the second session of the AKT. In the AKT, all the time, a dizziness question appeared or given. Underlying diagnosis like benign positional vertigo today. Maybe in the last time there was a question of benign positional vertigo. Any AKT candidate is here, you can tell. So all the case will not be benign positional vertigo in the elderly gentleman. There may be even dizziness, maybe due to the fatigability, underlying iron deficiency anemia. Dizziness, most common cause of dizziness in the world is functional anxiety disorder. So it may be the underlying diagnosis. So in the AKT, in your question is the stamp, if you can remember today's discussion, why Dr. Iram is asking these questions, surrogate is telling, no, no, no. Everywhere there is a message, almost. If academic candidate today, if you can understand the, the value of the answering no, then you can answer each and every question of the AKT relevant with the dizziness. I think things are clear. So we will try our best in the session to make it is suitable for OSCE, for AKT, and in general for any GP. For this reason, we took near about 1 hour time. Otherwise, those who know about the OSCE practice and others, we take for the practice purpose 10 minutes and some little discussion of 5 minutes or 20 minutes at best. Okay, near about 20-22 minutes. But today it is an heterogeneous gathering, and we will invite you for this another heterogeneous gathering from even I know some of the my beloved student also here. They are appearing for the MBBS exam, and they're very interested to join this session. Okay, so anyway, if someone sorry to read in the chat box, doctor, you better to open the mic if possible. Like ECG to look for the heart. Okay, ECG may be like again about the routine examination today or routine investigation. ECG, how can you correlate your symptom, your examination with the cardiac problem? Pulse is normal, pressure is normal, there is postural drop is not there. So ECG may not tell you something directly relevant with the dizziness. It is very, very true. If any arrhythmia is there, right, there could be relevant with the dizziness. Any postural drop, there will be dizziness. Patient might have hypertensive problem in the heart. But if you say, I like to do one ECG, yes, in the 65 years old, you can make a routine investigation like this. Though I said you routine, don't tell routine first. Yes, don't tell routine first. If you don't have, or if you cannot think any first line investigation directly relevant with the symptom, then come to your routine investigation plan. So satisfy your, in the exam especially, the requirement for your the investigation skill. Examiner will give you the mark for the investigation skill. That is the thing. But blood sugar check, doctor who attended, about the POCT, you can do in the chamber, blood sugar, ECG, dipstick, urine test. Minimum, you can say from this list, 3, 4, they are there. And it can cover your investigation part of your scale. Thank you, doctor. So from this checklist, I like to tell you what we do our practice. And this is the great clue for the vertigo, doctor. You can see in the screen, the episodic vertigo, just the duration of the episode can tell you the diagnostic clue. I hope that it is very nicely written with the color contrast in a mnemonic form also. Minutes to hour is the minutes, but minutes will have some additional the symptom and sign as well. In those patients, definitely you will do what you will do, Dr. Iram. If you suspect minutes, you will do Weber test and Rennes test. Deafness, right? For the deafness, you will do. If you think labyrinthitis, you will do this test. And even the clinical examination of the BPPV also, because patient telling that I don't have any hearing problem. If you think that I will be very minute about the ear because my disease in the ear, I need to check hearing issue. You can check the Rennes test and the Weber test. It would be good enough to say. Okay. So in the tinnitus, you see, patient tell tinnitus, you can think about the labyrinthitis. Okay. And the vestibular also, no hearing loss or tinnitus, vestibular neuronitis. But vestibular neuronitis not like BPPV. So this is a, especially we like to show you here the how the duration of the episode can help to diagnose. And it is until your OSCE also it is important. Okay. Now the book knowledge of the dizziness. All of you will be benefited from this. As a GP, in the part of the management for the benign positional vertigo, this is your job. Nothing to be left here. Okay. So in the management part, what actually we didn't discuss, book can help us after the diagnosis. Okay. It is a self-limiting disease. Few weeks can persist. Assurance is very important. Patient will be assured. Second thing, Epley's maneuver. Okay. Another thing, it is not actually termed as by something. It is said maintaining the trigger position until vertigo settles. For example, patient having the right-sided turning of the face causing the dizziness or that is a vertigo, we have to advise the patient keep your position until the dizziness or vertigo is resolved. And definitely you need to motivate the patient because patient telling that doctor I am afraid to fall, but you are telling that to keep this dizziness. This is the fear inside the patient. This is your job to resolve the fear. Assure that it will not disturb you, it will not cause any harm for you. Rather, it will make an adaptation. Your feelings of bad feelings actually will be lessened day by day. This is the way, whatever you think better, you explain to the patient. So maintaining the trigger position. And again, if patient is driving, advise not to drive. There is a safety, it is called the safety netting of the patient. Okay. Regarding the medication, actually evidence telling that no medicine will help for the benign positional vertigo. But in our general practice, we are giving some vestibular sedative because our diagnosis is not a clear cut. If I ask you today, how many of you have done Dix Hallpike test in the chamber? Maybe very few. So in that case, we are incomplete doctor, and we are giving some medicine to help, because these the vestibular sedatives are not very hazardous medicine. So like a placebo effect also will be there. But for the examinee, I am telling better not to say, because you see we have tried our best in the book, marked as the yellow with not helpful. Labyrinthine sedatives are not helpful. So better to avoid to give the medicine when you are very clean cut about your diagnosis, benign positional vertigo. So that's all, doctor, for today about the dizziness. I like we like to near about the finish now today. And for that thing, any time, doctor, now also you can raise the hand and you can discuss if you think or share. And we will be inviting you for everyone. And this is our contact. And there is some new YouTube link, maybe until you didn't get. I'm just giving you to your chat box, doctor. Thank you very much, doctor. All the best. May Almighty help. See you. Ma'assalam, doctor. Ila liqa.